Welcome back to the channel. Today we are tackling something that does not get nearly enough attention, and frankly, that frustrates me. We are talking about a class of medication called NSAIDs, non-steroidal anti-inflammatory drugs. Now, before your eyes glaze over at that term, let me translate it into plain English. NSAIDs are painkillers, common ones. The kind you reach for when your knee aches after gardening, when your back stiffens up on a cold morning, when arthritis flares and you just need relief so you can get through your day. We are talking about ibuprofen, that is Advil and Motrin. We are talking about naproxen, that is Aleve. We are talking about diclofenac, meloxicam, and celecoxib. Some of these are prescriptions, many are not. And because they sit on open shelves between the toothpaste and the vitamins, most people assume they are about as dangerous as a breath mint. They are not. For older adults especially, people over 50 and critically people over 60, regular use of these drugs carries cardiovascular risks that the medical community has understood for years, but that somehow never made it into the kitchen table conversation. Today, we are going to have that conversation. We are going to talk about what these drugs actually do inside an aging heart. We are going to cover the hidden symptoms that most people completely miss. And we are going to discuss what you can do instead, because nobody should have to choose between managing their pain and protecting their heart. Let me be clear about something before we go further. I am not telling you to throw your medication in the trash. That would be irresponsible. What I'm asking you to do is listen, learn, and then have an informed conversation with your own doctor. Fair enough? Good. Let us get into it. To understand the danger, you need a basic picture of how these drugs work once they enter your bloodstream. NSAIDs reduce pain and inflammation by blocking certain enzymes in your body called COX-1 and COX-2. Think of these enzymes like little chemical messengers. COX-2 messengers are the ones responsible for sending inflammation and pain signals. So when you take ibuprofen for a sore shoulder, the drug essentially tells those COX-2 messengers to sit down and be quiet. Pain goes down, swelling goes down, you feel better. Sounds perfect, right? Here is the problem. Those same COX enzymes are not only involved in pain, they also play a critical role in how your blood vessels function, how your kidneys regulate fluid, and how your blood forms clots. When you block them, especially COX-2, you set off a chain reaction that ripples through your entire cardiovascular system. First, your blood vessels constrict, they tighten. Imagine a garden hose and someone steps on it part way. The water still flows, but the pressure behind it builds. That is essentially what happens to your blood pressure. Studies published in the American Journal of Medicine and the European Heart Journal have repeatedly confirmed that regular NSAID use can raise systolic blood pressure, that top number, by an average of 3 to 6 points. Now, 3 to 6 points might sound trivial, but for someone who is already managing borderline hypertension, who is already on blood pressure medication, that increase can be the difference between controlled and uncontrolled. And uncontrolled blood pressure, sustained over weeks and months, is one of the leading contributors to heart attack and stroke in older adults. Second, NSAIDs promote sodium and water retention through their effects on the kidneys. Your kidneys are supposed to filter excess fluid. NSAIDs partially interfere with that process. The result is that your body holds on to more fluid than it should. Your ankles swell. Your fingers feel tight. You gain 2 or 3 pounds seemingly overnight. And that extra fluid does not just sit in your feet. It increases the total volume of blood your heart has to pump. For a healthy 30-year-old heart, that might be a minor inconvenience. For a 68-year-old heart that has been working for nearly 7 decades, that extra workload can push it toward a condition called heart failure. Not dramatic movie-style heart failure where someone collapses, the slow kind, the kind where you gradually cannot walk to the mailbox without stopping to catch your breath, and you assume it is just age. Third, and this is the one that concerns cardiac surgeons the most, NSAIDs shift the balance between 2 substances in your blood, prostacyclin and thromboxane. Prostacyclin keeps your blood vessels relaxed and prevents clots from forming too easily. Thromboxane does the opposite. It encourages clotting and vessel constriction. NSAIDs, particularly the COX-2 selective ones, tilt the balance heavily toward thromboxane. Translation: your blood becomes stickier, more prone to forming clots, and a clot in the wrong place, a coronary artery, a cerebral artery, that is a heart attack or a stroke. A landmark meta-analysis published in The Lancet, reviewing data from over 350,000 participants across more than 600 clinical trials, found that high-dose NSAID use was associated with roughly a one-third increase in the risk of major vascular events. One-third, for a drug people take as casually as a morning vitamin. Let me ask you something. Did anyone ever explain this to you when you picked up that bottle of Advil? Did the label say anything about your heart? For most people, the answer is no, and that is exactly why we are here. Now, here is where it gets really tricky, and honestly, where I think the most harm is done. The cardiovascular effects of NSAIDs do not announce themselves with dramatic, obvious symptoms. They creep, they whisper, and in older adults, those whispers get lost in the noise of normal aging complaints. Let me walk you through the most commonly missed warning signs. Symptom number 1. Unexplained ankle and leg swelling. You wake up one morning and your socks leave deep impressions around your ankles. Your shoes feel tighter by afternoon. Many seniors chalk this up to standing too long, or hot weather, or just getting older, and sometimes it is those things. But persistent lower extremity swelling, what doctors call peripheral edema, is one of the earliest signs that your body is retaining excess fluid. If you have been taking ibuprofen or naproxen regularly, say several times a week for arthritis or chronic back pain, that swelling may be directly related. Your kidneys are not clearing fluid the way they should because the drug is interfering with that process. Symptom number 2, gradual shortness of breath. This one is insidious. It does not happen all at once. It builds over weeks or months. You used to walk 3 blocks to the post office without thinking about it. Now you stop halfway and pretend you are looking at something in a shop window while you catch your breath. You used to climb the stairs carrying laundry. Now you leave the basket at the bottom and carry items up in small batches. Many seniors tell their families, "I just don't have the stamina I used to." And that might be partly true. But shortness of breath with exertion, especially new or worsening shortness of breath, is a hallmark symptom of fluid overload and early heart failure. When extra fluid accumulates in and around the lungs, every breath requires more effort. The medical term is dyspnea, and it deserves investigation, not dismissal. Symptom number 3, unexplained weight gain over a short period. We are not talking about gaining 5 pounds over the holidays because of your daughter-in-law's pecan pie. We are talking about gaining 2, 3, 4 pounds in a matter of days without changing what you eat. Fluids weigh a lot. A single liter of retained water adds about 2.2 pounds to your body. If your NSAID use is causing your kidneys to hold on to fluid, you will see it on the scale before you feel it anywhere else. This is why cardiologists often ask heart patients to weigh themselves every single morning. A sudden jump is an early alarm bell. Symptom number 4, increased blood pressure readings that seem to come from nowhere. Perhaps you have been managing your blood pressure well for years. Your numbers have been steady. And then, over the course of a few months, they start creeping upward. Your doctor increases your medication. The numbers stabilize for a while, then creep up again. If nobody asks, and sometimes nobody does, whether you have started taking over-the-counter pain relievers more frequently, the connection goes unnoticed. The NSAID is quietly working against your blood pressure medication, and you end up in a pharmacological tug-of-war where one drug is fighting the other inside your body. Symptom number 5, unusual fatigue and reduced exercise tolerance. Your heart is a muscle. When it has to work harder pumping against higher pressure, moving greater volumes of fluid, it tires more quickly. Older adults on regular NSAIDs sometimes describe a bone-deep tiredness that sleep does not fix. They feel drained by mid-afternoon. Activities they enjoyed became chores. Again, easy to blame on age, harder to connect to the little white pill they take with breakfast. Symptom number 6, heart palpitations or a fluttering sensation in the chest. This one scares people and it should prompt a doctor visit. NSAIDs can contribute to electrolyte imbalances, particularly potassium and sodium levels, through their kidney effects. Electrolyte disruption can irritate the heart's electrical system. The result might be occasional skipped beats, a racing sensation, or a fluttering feeling behind the breastbone. For someone with a pre-existing arrhythmia like atrial fibrillation, this can destabilize a rhythm that was previously well controlled. Now, I want to pause here and say something important directly to you. If you are over 60, or if you are caring for an elderly loved one, this information could genuinely be life-saving. Not because NSAIDs are poison, they are not. They are effective medications with legitimate uses, but because understanding the risks allows you to make informed choices rather than blind ones. And informed choices are what keep people alive and well for longer. If any of what I have described sounds familiar, the swelling, the breathlessness, the creeping blood pressure, please do not panic, but do bring it up with your doctor. Specifically mention how often you take over-the-counter pain relievers. Many physicians do not think to ask, and many patients do not think to volunteer that information because they assume over-the-counter means insignificant. It does not. Not every person who takes an ibuprofen is going to develop heart problems. Context matters enormously. So let us talk about who needs to be most careful. People with existing heart disease or a history of heart attack or stroke. The FDA issued a strengthened warning in 2015 stating that NSAIDs increase the risk of heart attack and stroke, and that risk is greater in people who already have cardiovascular disease. Even short-term use, as little as 1 to 2 weeks, can elevate risk in this population. If you have had a cardiac event, stents placed, bypass surgery, or a diagnosed condition like coronary artery disease, NSAIDs should be treated with the same caution you would give any serious medication. People with heart failure, even early stage. We discussed the fluid retention mechanism. For someone whose heart is already struggling to pump efficiently, the additional fluid load from NSAID use can precipitate an acute heart failure episode, the kind that lands you in the emergency room unable to breathe at 3 in the morning. People with high blood pressure, particularly those whose pressure is not optimally controlled. The blood pressure-raising effect of NSAIDs can erase the benefits of antihypertensive medications. Some studies suggest that NSAID use is one of the most common and least recognized causes of resistant hypertension in older adults. People with kidney disease. The kidneys and the heart are deeply interconnected. What harms one often harms the other. NSAIDs reduce blood flow to the kidneys, which can worsen existing kidney impairment and amplify the cardiovascular effects we have been discussing. People taking blood thinners like warfarin or direct oral anticoagulants. NSAIDs increase bleeding risk on their own. Combined with anticoagulants, the risk of gastrointestinal bleeding or hemorrhagic events climbs substantially. And frankly, anyone over 65 taking NSAIDs regularly, meaning most days of the week for more than a couple of weeks at a stretch. Age itself is a risk factor because the cardiovascular and renal systems are less resilient, less able to compensate for the biochemical disruptions these drugs cause. Here's a question worth asking yourself right now. How often do you actually take these pills? Not how often you think you take them, how often you really take them. Many people underestimate their usage because the pills are so accessible. 2 with breakfast for the knee, 2 more at bedtime because the back tightened up, a couple extra on a bad day. It adds up faster than most people realize. So what do you do if you are in pain? Because that is the real question, is it not? Nobody takes NSAIDs for fun. They take them because something hurts, and hurting is miserable, and they want to live their lives without wincing every time they stand up from a chair. Pain management in older adults requires a more nuanced approach than simply reaching for the nearest bottle. Here are strategies that cardiac surgeons and geriatric specialists frequently recommend. Acetaminophen as a first-line alternative. Acetaminophen, that is Tylenol, works differently from NSAIDs. It does not carry the same cardiovascular risks. It does not raise blood pressure. It does not cause fluid retention. For mild to moderate pain from osteoarthritis, headaches, or general aches, Acetaminophen at appropriate doses is often effective and significantly safer for the heart. The caution with acetaminophen is liver health. You must stay within recommended doses and avoid combining it with alcohol, but for cardiovascular safety, it is a far gentler option. Topical pain relievers. Topical diclofenac gel. Brands like Voltaren delivers anti-inflammatory medication directly to the joint or muscle that hurts, with dramatically less systemic absorption. That means far less of the drug circulates through your bloodstream to affect your heart, kidneys, and blood vessels. For knee arthritis, hand arthritis, or localized muscle pain, topical formulations can be remarkably effective. Capsaicin cream, lidocaine patches, and menthol-based rubs are additional options worth discussing with your physician. Physical therapy and movement. I know. When something hurts, the last thing you want to hear is move more. But targeted exercise, gentle stretching, water aerobics, tai chi, supervised strength training reduces chronic pain over time by strengthening the muscles that support painful joints, improving circulation, and releasing the body's own natural pain-relieving chemicals called endorphins. Multiple clinical trials have demonstrated that consistent low-impact exercise can be as effective as NSAIDs for osteoarthritis pain without a single cardiovascular side effect. Heat and cold therapy. Simple, inexpensive, and underused. A warm compress on a stiff back, an ice pack wrapped in a towel on a swollen knee. Alternating between the two, these methods reduce pain and inflammation locally and cost virtually nothing. Mind-body approaches. Chronic pain has a significant psychological component, not because the pain is imaginary, but because the brain's perception of pain is influenced by stress, sleep quality, mood, and attention. Techniques like guided meditation, deep breathing exercises, and cognitive behavioral therapy for pain management have strong clinical evidence behind them. They will not replace medication entirely for everyone, but they can reduce how much medication you need. Supplements with anti-inflammatory properties. Omega-3 fatty acids from fish oil, turmeric with black pepper for absorption, and ginger extract have all shown modest anti-inflammatory effects in clinical studies. They are not miracle cures. They will not work overnight, but as part of a broader pain management strategy, they can contribute meaningfully. Always check with your doctor before adding supplements, because even natural products can interact with prescription medications. And if NSAIDs are truly necessary, sometimes they are. Sometimes the pain is severe enough and the alternatives insufficient enough that an NSAID is the right call. In those cases, the guiding principle is the lowest effective dose for the shortest possible duration. Not a standing daily regimen for months on end, but targeted use during flares, with regular monitoring of blood pressure, kidney function, and symptoms. Your doctor can help you find that balance. The important thing is that the decision is made deliberately and with full knowledge of the trade-offs, not by default because the bottle was sitting on the kitchen counter. I want to encourage you to do something specific after watching this video. At your next doctor's appointment, or sooner if anything we discussed today resonated with you, bring a complete list of every medication you take, and I mean every medication, prescription and over-the-counter. The blood pressure pill your cardiologist prescribed and the Aleve you grab from the drawer when your hip flares up, the aspirin you take because you heard it was good for your heart, and the ibuprofen you use for headaches. Lay it all on the table. Literally bring the bottles if you have to. Then ask your doctor 3 questions. First, are any of these medications working against each other? Second, is my current pain management approach the safest option given my heart health? Third, what changes would you recommend? Many seniors feel uncomfortable questioning their own routines, as though admitting they take over-the-counter medication is something to be embarrassed about. There is zero shame in it. There is only wisdom in reviewing what you put into your body as your body changes with age. A medication routine that was perfectly fine at 55 might need adjustment at 67. That is not failure. That is smart, proactive health management. And for those of you watching who care for an older parent or grandparent, gently ask them what they take for pain. Check their medicine cabinet. You might be surprised how many bottles of ibuprofen or naproxen are in there, half empty, quietly doing their work, unexamined. Let me bring this together. NSAIDs, ibuprofen, naproxen, and their cousins are not evil drugs. They have helped millions of people manage pain and inflammation, but they carry real cardiovascular risks that increase significantly with age, and those risks are magnified in people who already have heart disease, high blood pressure, kidney problems, or heart failure. The hidden symptoms, swelling, breathlessness, unexplained weight gain, creeping blood pressure, deep fatigue, palpitations, masquerade as normal aging. They are easy to dismiss. They are easy to ignore. And that is precisely what makes them dangerous. You deserve to understand what your medications are doing inside your body. You deserve a pain management plan that accounts for your heart, not just your joints. And you deserve to walk into your doctor's office armed with the right questions. Your heart has carried you through decades of life, through raising children, through careers, through loss and joy, and everything in between. It has beaten roughly 2.5 billion times by age 70. It is the most loyal worker you have ever employed. Treat it with the respect it has earned. If this video gave you something to think about, hit that subscribe button so you do not miss the next one. We cover senior health topics every week with the same depth and honesty you got today. Share this with someone you care about, a spouse, a sibling, a friend from church who complains about their knees, anyone over 50 who might benefit from hearing this. And drop a comment below telling me, did you know about these risks before today? I read every single comment, and your stories help shape the topics we cover next. Take care of yourselves, take care of each other, and I will see you in the next video.